You went to the ER. You saw the specialist. You wore the boot. You did the physical therapy. Maybe even tried an injection. And a year later, you are still in pain. If that's you right now, stay with me. I'm your host, Susie Rains, and you're listening to Health Over Wealth in the U.S., the podcast that helps Americans find cash-based, client-centered care outside of the traditional insurance system. Health Over Wealth in the U.S. is produced by the Centered Care Directory for educational purposes only, not medical or financial advice. Always consult a qualified healthcare professional for your specific situation. Today, we're talking about a problem a lot of Americans are living with right now. An injury that just will not heal, no matter how closely they follow the standard treatment plan. Rest, a boot or brace, physical therapy, maybe an injection, and still pain, months or even years later. This episode comes from an article by Dr. Robert Kornfeld, a functional whole-body podiatrist practicing at the Chronic Foot Pain Center in the New York area. And he also practices at Continuum Injury and Wellness Center in Fort Lauderdale, Florida. Dr. Kornfeld's core idea is simple, but it changes everything. The foot and ankle do not exist in isolation. They're connected to your immune system, your hormones, sleep, gut, your stress levels, every system in your body. So when healing stalls, the reason is rarely just the injury itself. Here's something most people are not told. Tendons get far less blood flow than muscle does. That's why tendon injuries can take 6 months to a year or longer to heal, even in ideal conditions. Standard care treats the structural injury. Rest, immobilization, anti-inflammatories, physical therapy, sometimes a PRP injection or a recommendation for surgery. All of that assumes your body's healing environment is working correctly. Often it isn't. And that's the question standard care rarely asks. Why is this person not healing in the first place? Dr. Kornfeld shares a real patient case that shows exactly what happens when someone finally asks that question. A 61-year-old woman came into his practice after 15 months of unresolved ankle pain. It started during a pickleball game, sharp pain, and she stopped immediately and sought care right away. Over the next 15 months, she saw 4 different providers. An ER doctor diagnosed a sprain, no imaging. A podiatrist put her on a walking boot, still no imaging. Weeks later, an MRI finally revealed a split tear of the posterior tibial tendon, a key tendon that supports the arch of the foot. She did physical therapy. She had a PRP injection. 3 months later, no meaningful improvement. She was told her only remaining options were shockwave therapy or surgery. That's when she sought a different kind of care. When she came to Dr. Kornfeld's practice, the intake went far beyond her ankle. She reported chronic anxiety, frequent illness, joint inflammation throughout her body, reoccurring headaches, digestive symptoms after eating, what she called slow healing whenever she got injured. She was sleeping 3 to 4 hours a night. Her diet was low in protein and calories, high in carbohydrates. She was significantly underhydrated. Lab work, not standard orthopedic panels, but a deep look at her whole system, found elevated stress hormones, a mineral imbalance affecting tissue repair, very high levels of pro-inflammatory compound, and a genetic variant linked to connective tissue disorders. Wow, that's not on a standard blood panel. She was referred to a rheumatologist to rule out hereditable connective tissue condition. None of these findings were structural. Every one of them was affected by her ability to heal. So before any further injections, her care plan addressed the environment inside her body first. Sleep hygiene, hydration, protein and caloric intake, stress management, targeted supplementation based on her specific labs. Only once those foundational factors were stabilized did the structural treatment begin. A series of prolotherapy injections, which stimulate the body's natural repair response in connective tissue, followed by a second regenerative injection to support continued healing. Guess what? 5 months later, she was asymptomatic. No more symptoms. No more pain. Her overall health and vitality had improved significantly. A follow-up MRI was ordered to confirm what her symptoms already showed. The tear had healed. Dr. Kornfeld also addressed something a lot of people wonder about. Why doesn't PRP always work? A 2019 review of 17 studies on PRP for tendon injuries found the evidence was mixed. Favorable in roughly half the studies, but the overall quality of evidence was rated low and results varied a lot from patient to patient. Here's why that matters. PRP works by activating your body's own healing response. If the response is already compromised by poor sleep, nutritional gaps, chronic inflammation, or high-stress hormones, the injection has very little to work with. Addressing those underlying factors first is what gives regenerative treatments like PRP and prolotherapy the environment they actually need to work. If you're dealing with an injury that hasn't resolved despite doing everything you were told to do, whole body and functional medicine practitioners across the United States are searchable by location and specialty at healthoverwealth.us. If this episode helped you understand your own healing journey a little bit differently, hit follow or subscribe so you don't miss what's next. And remember, you can always search for cash-based, client-centered practitioner near you at healthoverwealth.us. Dr. Kornfeld is not in isolation. There are thousands of practitioners across the country who practice the same way he does. Whole body health, root cause medicine, looking at your own body's immune system and how it helps in healing. Health Over Wealth in the U.S., you have options.